A 62-year-old man comes to the emergency department because of confusion and lethargy. His family reports that he has become increasingly forgetful and has had difficulty with simple tasks. Before this, he had progressive abdominal distension, easy bruising, and constipation. On examination, he is disoriented to time and place. When asked to extend his arms and extend his hands upwards, he is unable to hold them in place and instead displays jerking movements. The physician percusses dullness over an area of the patient's abdomen, which shifts downward after the patient assumes the decubitus position. Which of the following is most likely to be found in this patient? Choice A, amyloid plaques and neurofibrillary tangles found on brain biopsy. Choice B, increased blood flow between the superior rectal veins and inferior rectal veins. Choice C, increased blood flow between the left colic vein and azygos vein. Choice D, increased blood flow between the right gastroepiploic vein and azygos vein. Choice E, increased blood flow between the superficial epigastric vein and hypogastric vein. 5 seconds and I'll answer the question. So, it should be obvious this is hepatic encephalopathy. You have the asterixis, which is flapping tremor, and you have shifting dullness, which represents ascites, which also explains his abdominal distension. His bruising can be a result of liver failure leading to reduced clotting factors and thrombocytopenia. So obviously the answer choices here are very focused on the portosystemic shunts, which is the main thing I wanted to test on with this question. So you should just know the 3 big portosystemic shunts because I would say they're all pretty high yield. So first you have esophageal varices, which results from left gastric to azygos vein shunting. And obviously this is a huge bleeding risk, right? A lot of people with liver failure can die from just bleeding of the esophageal varices. Another big one, and the correct answer choice here, is the shunt between superior and the middle or inferior rectal veins, which is choice B here, which can result in hemorrhoids. You'll note that in the question I did in fact write that he has had constipation. And then the last one, which is not as high yield, but still pretty important, I would say, is shunting between the superior, inferior, or superior epigastric veins to the paraumbilical veins, which results in caput medusae, which, as the name implies, are big engorged veins that look kind of like snakes, and they run across your belly, essentially, around your umbilicus. So with that fresh in our minds, we can look at choices C and D, which correctly identify the azygos vein, but they do not identify the origin of the shunt correctly. It's supposed to come from the left gastric vein, not the left colic or right gastroepiploic vein. And similarly, choice E, superficial epigastric vein can be an origin for caput medusae, but it does not go to the hypogastric vein. It goes to paraumbilical vein. And choice A, finally, that's just a distractor, right? Some students might overly focus on the fact that this patient has forgetfulness, and yeah, he's 62 and maybe he has Alzheimer's, but that's obviously not the focus of the question. So in summation, know your portosystemic shunts. Left gastric to azygos for esophageal varices, superior rectal to middle or inferior rectal for hemorrhoids, and superficial inferior or superior epigastric vein to paraumbilical veins for caput medusae. I hope this video was helpful. I'll see you in the next one.